Hello, I'm Dr. Tracy Paschke with Heart Health Prevention and Wellness. I wanted to talk to you today about the latest testing in preventive cardiology. I'm a preventive cardiologist, so I help people prevent heart attacks and heart failure and abnormal heart rhythms. And I wanted to spend just a little bit of time talking about the latest testing that's available for us to determine people's cardiac risk. So first, I wanted to talk about two lab values. So these are things that we can check in your blood work. One is ApoB and one is Lp(a). And you may have heard these terms. People are kind of talking about it. You know, the standard lipid profile, the one that you get maybe even every year, shows your total cholesterol, your HDL, which is the good cholesterol, your triglycerides, and the LDL, which is the bad cholesterol. So that's the standard lipid profile. We know from recent data that there are some other lipoproteins that are very important and can even tell us a little more about your cardiac risk. So one of those is ApoB and one of those is Lp(a). Lp(a) is the one that's genetically transmitted more than any of the other lipoproteins, and often it can explain why heart disease runs in families. So we know there are certain families that lots of people have had heart attacks, and when people get their cholesterol checked, they're always told it's okay, and we don't really know why you have this family history. Well, often it's this Lp(a) that's genetically transmitted, and that can increase your cardiac risk. We know that Lp(a) is more atherogenic and more thrombogenic, meaning it's more likely to cause plaque and it's more likely to cause blood clots. And so, again, those things increase your risk. ApoB is a protein that's attached to different lipoproteins, and it gives more of a direct measurement of your cholesterol levels. So it's a more direct measurement of all the particles that can contribute to your cardiovascular risk. So, you know, when we check that standard lipid profile, the LDL on that panel is a calculated value. ApoB gives us a more direct measurement. So it's very helpful in helping determine cardiac risk. And then the other lab markers that are important are inflammatory markers, because we know that atherosclerosis, it's two parts actually. So one is the cholesterol that makes the plaque, but the second part is, why do some people have plaques and not others? So some people can have high cholesterol and no plaque, and other people can have lower cholesterol and lots of plaque. It's thought that the link is inflammation. So the more inflammation in the body, the more likely we are to develop atherosclerosis. So that's why things like rheumatoid arthritis and inflammatory bowel disease, we know that people with those conditions have increased cardiovascular risk. And again, it's thought to be mediated through inflammation. Well, a lot of things can influence inflammation in the body. The standard American diet that's full of meat and saturated fats increases inflammation. Sugar and white flour increase inflammation in the body. Stress does. Poor sleep does. So we can measure some of those inflammatory markers in the bloodstream and see how much inflammation you have in your body. High sensitivity C-reactive protein, things like myeloperoxidase, things like LPPLA2, those are all inflammatory markers that we can measure in the blood. And then the last thing I wanted to talk about was in terms of imaging. We don't have any standard imaging that's recommended to look for plaque. We do some assumptions based on your lipid panel, but there's no standard testing that we do to look for plaque itself. Now, there are tests, but insurance doesn't pay for them, and so often people don't get them. So I tell people we get mammograms to screen for breast cancer and colonoscopies to screen for colorectal cancer, but there's no direct imaging that's recommended to screen for cardiovascular disease, which is a problem because cardiovascular disease is the #1 killer of men and women in the world. So I try to educate people that there is imaging that we can do. There are different things. There's carotid intima-media thickness and imaging the neck arteries for carotid plaque. That looks for plaque in the neck, which we know correlates to plaque in the heart arteries, so still not direct visualization of the heart arteries, but useful. It's an inexpensive, easy test to do. Other testing you might have heard is a CT calcium score, which is a great screening tool. Pretty inexpensive these days, around $100, and lots of places do those. We know that people with elevated calcium scores have increased cardiovascular risk. And then sort of the latest, greatest testing is coronary CTA, so that's a 3-dimensional picture of your heart arteries, so we can see inside your heart arteries through a CT scan. And then we can add a different analysis of plaque. An example is Cleerly. Heart flow plaque is another one. It lets us look at plaque in your arteries and tells us whether that plaque is hard plaque, soft plaque, or mixed. So tests like the CT calcium score look only for hard plaque, which is the more stable plaque. The more concerning type of plaque is soft plaque. That's the unstable plaque that's more likely to rupture. And the coronary CTA can look at plaque, and then the things like the Cleerly analysis can analyze that plaque and tell us what type of plaque it is. It tells us the percentage of stenosis, so how much blockage it's causing, and it tells us where the plaque is. So very helpful test. And it's good for not only seeing what you have, right? So this is personalized precision medicine. What do I have? What are my markers like? What does my imaging show? So then a preventive cardiologist like myself can take that information and really dial in on what's most helpful for you. So if we find mild plaque, then we address all the things that can contribute to that plaque. Things like diet and stress and sleep and, things that you might be doing to harm yourself. Maybe you're not even aware of those things. So we can work on those risk factors. And sometimes people need different supplements, different medications. A lot of people don't like to take prescription medications, but in some cases we know they are helpful. But again, there are a lot of things that we can do regarding people's lifestyle that can help just as much often as prescription medications. So that's kind of the latest, greatest in testing for preventive cardiology. If you need a preventive cardiologist, you can reach out to me. I'm accepting new clients. You can email me at info@hearthealth.care, and you can check out my website at www.hearthealth.care. All right, see you next time.